Your heart doesn't always send dramatic, unmistakable signals like crushing chest pain. Sometimes the first hints that something might be amiss with your cardiovascular system are far more subtle, appearing in your breathing, your legs, your skin, your energy levels, your sleep, or even how your body responds to simple movements. These quiet whispers from your body can be easy to dismiss, but understanding them could be crucial for your long-term health. This video will guide you through 7 visible signs that might suggest an underlying cardiovascular or circulation issue. Then we'll explore 7 symptoms you might feel when your heart or circulation isn't functioning optimally. Finally, we'll discuss practical, safe prevention tips and clarify when it's time to seek professional medical guidance. The aim isn't to create alarm, but to empower you with knowledge, helping you recognize potential warning signs, understand your risks, and encourage appropriate medical evaluation when necessary. This information is especially important if you have a family history of heart disease, experience unexplained tiredness or shortness of breath, notice swelling, or manage conditions like high blood pressure, high cholesterol, or diabetes. Let's begin with the visible clues your body might be offering. 7 visible signs your heart might not be healthy. Diagonal earlobe crease. You might notice a diagonal crease running across your earlobe, sometimes called Frank's sign. While it can be a normal part of aging or simply a genetic trait, some studies have observed an association between this crease and an increased risk of cardiovascular disease. It's not a diagnostic tool for blocked arteries, and many people with this crease have perfectly healthy hearts. However, if you spot this sign, especially if you have other risk factors like high blood pressure or cholesterol, it can serve as a gentle reminder to review your overall heart health with your doctor. It's one piece of a larger puzzle, not a definitive answer. Hair loss on the legs. Reduced hair growth or even complete loss on your legs, particularly the lower legs, can sometimes be a subtle indicator of poor circulation. When blood flow to the extremities is compromised, the hair follicles don't receive enough oxygen and nutrients, leading to slower growth or loss. This sign is particularly concerning if it's accompanied by other symptoms such as cold feet, shiny or thin skin on the legs, slow-growing toenails, leg pain when walking, which improves with rest, or wounds on the legs or feet that are slow to heal. While hair loss can have many non-cardiac causes, if you notice this pattern, especially with other circulatory symptoms, it's worth discussing with a healthcare professional to rule out conditions like peripheral artery disease, PAD. Yellowish deposits around your eyelids. These yellowish fatty deposits, often appearing on or around your eyelids, are known as xanthelasma. They are essentially cholesterol deposits under the skin. While they are harmless in themselves, their presence can sometimes be a visible clue that you might have high cholesterol or high triglyceride levels in your blood. Not everyone with high cholesterol develops xanthelasma, and not everyone with xanthelasma has high cholesterol. However, if you notice these deposits, it's a good reason to get your lipid profile checked by your doctor. Managing high cholesterol is a key part of preventing cardiovascular disease. Gray or white ring around the cornea. A gray or white ring appearing around the outer edge of the cornea, the clear front part of your eye, is called corneal arcus or arcus senilis. In older adults, this is often a common and benign sign of aging with no significant health implications. However, if this ring appears in younger individuals, especially under the age of 40 or 50, it can sometimes be associated with high cholesterol levels and an increased risk of heart disease. If you are younger and notice this ring, it's a good idea to have your cholesterol levels evaluated as part of a broader cardiovascular risk assessment. Bluish or purplish skin tone. A bluish or purplish tint to the skin, lips, fingers, or toes, known as cyanosis, suggests that your blood isn't carrying enough oxygen. This can happen due to various reasons, including exposure to extreme cold, which constricts blood vessels. However, if cyanosis appears without a clear external cause, or if it's accompanied by symptoms like shortness of breath, chest discomfort, confusion, or unusual weakness, it can be a serious sign of a problem with your heart or lungs. Your heart's job is to pump oxygen-rich blood throughout your body. If it's struggling, or if there's a problem with your lungs, oxygen delivery can be compromised. If you observe persistent or sudden cyanosis, especially with other concerning symptoms, it warrants immediate medical attention. Non-healing sores on feet or legs. Wounds, cuts, or sores on your feet or lower legs that are slow to heal or don't heal at all can be a significant warning sign. Good circulation is essential for wound healing, as blood delivers the necessary oxygen, nutrients, and immune cells to the damaged tissue. If your heart isn't pumping blood effectively, or if arteries are narrowed due to plaque buildup, peripheral artery disease, blood flow to the extremities can be severely reduced. This makes even minor injuries difficult to heal and increases the risk of infection. This sign is particularly critical for individuals with diabetes, as both diabetes and poor circulation can severely impair wound healing. If you have non-healing sores, especially on your lower limbs, seek prompt medical evaluation. Swelling in legs, ankles, or feet. Swelling, or edema, in the lower extremities is a common issue with many potential causes, ranging from standing for long periods to certain medications, vein problems, or kidney and liver conditions. However, persistent or worsening swelling in the legs, ankles, or feet can be a sign of heart failure. When the heart struggles to pump blood efficiently, fluid can back up in the veins and leak into the surrounding tissues, leading to noticeable swelling. This is particularly concerning if the swelling is accompanied by other symptoms such as increasing shortness of breath, unusual fatigue, or needing to use more pillows to breathe comfortably at night. If you experience persistent or unexplained swelling, especially with these accompanying symptoms, it's crucial to consult a healthcare professional for an accurate diagnosis. These visible signs are not definitive diagnoses, but rather potential clues that your body might be sending. They are signals to pay attention, understand your risk, and seek professional medical guidance when necessary. Your body rarely sends only one clue. It often sends patterns. Now, let's turn our attention to the symptoms you might feel when your heart or circulation isn't working as it should. 7 symptoms people may feel. 1. Shortness of breath with effort. Feeling breathless after intense exercise is normal, but if you find yourself becoming unusually short of breath during activities that were previously easy, like walking up a flight of stairs, carrying groceries, or even just walking across a room, this change can be a significant warning sign. This symptom, known as dyspnea, can indicate that your heart is struggling to pump enough oxygen-rich blood to meet your body's demands, or that fluid is building up in your lungs due to heart failure. It can also be a sign of lung conditions, but if it's new, persistent, or worsening, and especially if it's accompanied by fatigue or swelling, it warrants medical evaluation. The key is not just the symptom itself, but whether it is new, persistent, or getting worse compared to your usual activity level. 2. Persistent cough, especially with white or pink-tinged mucus. A persistent cough can be caused by many things, from allergies and infections to asthma or acid reflux. However, in the context of heart problems, particularly heart failure, a chronic cough can occur when fluid backs up into the lungs. This fluid can irritate the airways, leading to a persistent cough that might produce white or pink-tinged frothy mucus. This type of cough is often accompanied by shortness of breath, especially when lying down, and general fatigue. If you have a persistent cough, particularly one that is new, doesn't respond to typical cough remedies, and is accompanied by other symptoms like swelling or unusual tiredness, it's important to have it checked by a doctor. 4. Trouble breathing when lying down or waking up gasping. If you find yourself needing to use more pillows to sleep comfortably because lying flat makes you feel short of breath, a condition called orthopnea, or if you wake up suddenly in the middle of the night gasping for air, known as paroxysmal nocturnal dyspnea, these are serious symptoms that should not be ignored. Both can be strong indicators that fluid is accumulating in your lungs due to your heart's inability to pump effectively. When you lie down, this fluid can spread more evenly across the lungs, making breathing difficult. These symptoms require prompt medical attention to determine the underlying cause and receive appropriate treatment. 4. unusual fatigue or weakness. Everyone feels tired from time to time, and fatigue is a common symptom of many conditions, including stress, a lack of sleep, or minor illnesses. However, heart-related fatigue is often described as a profound, unusual, and persistent tiredness that doesn't improve with rest. It's a disproportionate exhaustion where everyday tasks become incredibly difficult and you feel drained after even light activity. This happens because your heart isn't pumping enough blood to deliver adequate oxygen and nutrients to your muscles and organs. If you experience new, persistent, and unexplained fatigue that significantly impacts your daily life, it's a symptom worth discussing with your doctor, especially if you have other risk factors for heart disease.
Frequent urination at night. Waking up multiple times during the night to urinate, nocturia, can have various causes, including fluid intake before bed, diabetes, prostate issues in men, or certain medications. However, in some heart conditions, particularly heart failure, fluid that has accumulated in the legs and feet during the day can be reabsorbed into the bloodstream when you lie down at night. This increased fluid volume then gets processed by the kidneys, leading to more frequent urination. If you notice a significant increase in nighttime urination, especially if it's accompanied by swelling in your legs or shortness of breath, it could be a clue related to your heart health and should be evaluated by a healthcare professional. 6. Calf pain when walking that improves with rest. If you experience pain, tightness, cramping, or a heavy sensation in your calf, thigh, or buttocks that consistently occurs during physical activity like walking, but then reliably subsides after a few minutes of rest, this is a classic symptom of intermittent claudication. This condition is a hallmark of peripheral artery disease, PAD, where arteries in the legs are narrowed by plaque buildup, restricting blood flow. When you exercise, your leg muscles demand more oxygen, but the narrowed arteries can't deliver enough, causing pain. Resting reduces the demand and the pain goes away. If you experience this pattern of leg pain, it's crucial to seek medical evaluation, as PAD is a strong indicator of widespread atherosclerosis and an increased risk of heart attack and stroke. 7. Chest discomfort. This is perhaps the most urgent and widely recognized symptom associated with heart problems. Chest discomfort can manifest in many ways. It might feel like pressure, squeezing, fullness, heaviness, burning, or tightness. It's not always a sharp, stabbing pain. This discomfort may spread beyond your chest to your arm, often the left, but can be either, jaw, neck, back, stomach, or shoulders. It can be accompanied by other symptoms such as sweating, nausea, dizziness, lightheadedness, or shortness of breath. If you experience new, severe, persistent, or concerning chest discomfort, especially if it comes with any of these accompanying symptoms, it is critical to seek emergency medical help immediately. Do not try to wait it out or self-diagnose. This is a situation where every minute counts. These signs and symptoms, whether visible or felt, are your body's way of communicating. They are not meant to cause panic, but to encourage informed action. The goal is not fear. The goal is early action. Prevention and what to do next. Understanding these signs and symptoms is a powerful first step, but proactive prevention is key to long-term heart health. While no single action guarantees immunity from heart disease, adopting healthy habits can significantly reduce your risk and improve your overall well-being. Get regular physical activity. Aim for at least 150 minutes of moderate-intensity aerobic activity or 75 minutes of vigorous intensity activity per week, along with muscle-strengthening activities on 2 or more days. This could be brisk walking, swimming, cycling, or dancing. Adapt your activity level to your ability and any existing medical conditions, always consulting your doctor before starting a new exercise regimen. Regular movement strengthens your heart, improves circulation, and helps manage weight and blood pressure.
Stop smoking or seek help to quit. Smoking is one of the most significant risk factors for heart disease, damaging blood vessels and increasing plaque buildup. Quitting smoking is arguably the single most impactful step you can take to improve your cardiovascular health. There are many resources available to help you quit, from nicotine replacement therapies to counseling. Maintain a healthy weight. Carrying excess weight, especially around the abdomen, increases your risk of high blood pressure, high cholesterol, and diabetes, all major contributors to heart disease. Achieving and maintaining a healthy weight through diet and exercise can dramatically reduce these risks. Eat a heart-supportive diet. Focus on a diet rich in vegetables, fruits, whole grains, lean proteins, and healthy fats, like those found in olive oil, avocados, and nuts. Limit saturated and trans fats, added sugars, and excessive sodium. Incorporate fiber-rich foods like legumes and oats. Reducing ultra-processed foods can also have a profound positive impact on your heart health. Know your family history. Heart disease often runs in families. Understanding your family's medical history can help you and your doctor assess your personal risk and guide screening and prevention strategies. If close relatives had heart disease at a young age, your risk might be higher. Check cholesterol and triglycerides. Regular blood tests can monitor your cholesterol levels, LDL, HDL, and total cholesterol. High levels of bad cholesterol, LDL, and triglycerides contribute to plaque buildup in your arteries. Your doctor can help you understand your numbers and recommend lifestyle changes or medication if needed. Control blood sugar if diabetic or pre-diabetic. Diabetes significantly increases the risk of heart disease. If you have diabetes or pre-diabetes, carefully managing your blood sugar levels through diet, exercise, and medication is crucial for protecting your heart and blood vessels. Sleep well and manage stress. Chronic stress and insufficient sleep can both negatively impact heart health, contributing to high blood pressure and inflammation. Prioritize 7 to 9 hours of quality sleep per night and find healthy ways to manage stress, such as meditation, yoga, spending time in nature, or engaging in hobbies. Attend regular medical checkups. If you have risk factors for heart disease, regular checkups with your doctor are essential. They can monitor your blood pressure, cholesterol, blood sugar, and discuss any symptoms or concerns you may have. Early detection and management of risk factors are vital. It's important to remember that lifestyle changes are powerful tools for prevention and risk reduction, but they do not replace professional medical care. If you have existing heart conditions or are taking medication, always follow your doctor's advice. Do not stop any prescribed medication without consulting your healthcare provider. If you experience chest discomfort, severe shortness of breath, pain spreading to your arm, jaw, neck, or back, fainting, severe weakness, cold sweat, or any symptoms that feel sudden, severe, or urgent, please seek emergency medical help immediately. These are situations where prompt action can save lives. The goal is not to become afraid of every mark on your skin or every tired day. The goal is to notice patterns early, understand your risk, and act before a small warning becomes a serious emergency. Your heart is a vital organ, and by paying attention to its signals and taking proactive steps, you can significantly improve your chances of a long, healthy life. Which of these signs or symptoms surprised you the most? Let me know in the comments below. If you found this information helpful, please share this video with someone who has high blood pressure, high cholesterol, diabetes, a family history of heart disease, or unexplained fatigue or shortness of breath. And don't forget to subscribe for more clear, science-based health content.